Hi guys, today's Wellness Wednesday, and Dr. Savitha already promised you guys last week that she's going to give you some information on how to keep your brain healthy as well, yes. Not just everything else, your heart. On the previous week we talked about that. So anyway, Doc, what kind of supplements or regular nutritional intake, what they should use to make sure that the brain is going to function properly, they're going to be able to alleviate stress and deal with stress, and they're going to lesser anxiety or even depression?
So, when we look at the brain and the way that it functions, there are many different ways to kind of assimilate what's going on. There's the right and the left side of the brain that function independently but together in order to be able to give us the different ways to react to situations and think about things. So we always talk about sleep as being an essential part of the brain function, and then if that's half the time, then the other half the time essentially is the awake state. So being able to, during the daytime, maintain focus, attention, be able to utilize all of the things that we do. I know that we talk about ashwagandha as an ability to maintain focus and clarity, and to be able to utilize the effect from the adrenal glands on our cortisol levels, which is our stress hormones, again, speaking to the brain, to be able to keep that going all day long too. So ashwagandha is a really good one when we talk about focus, clarity, mental awareness, and so forth. Another one that helps with anxiety or keeping the brain under good, wraps per se, is GABA. GABA, we know, helps with certain neurotransmitters in the brain, GABA being one of them, kind of helps in some of those junctions to be able to make those connections appropriately. And patients sometimes find with a decreased amount of GABA in their body, they're unable to maintain that connection appropriately. So there is supplementation of GABA. Make sure you focus appropriately to talk to your doctor about that, whether that's right for you too, because you don't want to take it inappropriately either. Any of these supplements. So those are the ones we talk about in the awake status that I think about on a more regular basis when I speak to patients. GABA helps to calm patients down. So we use it for patients who, when they have a lack of it, like anxiety and things like that.
Got it. 5-HTP.
5-HTP is great. It's actually a little piece of Thanksgiving heaven, I call it turkey in the bottle, because when you go into Walmart and Black Friday and don't want to really hurt anybody, you take 5-HTP. But in all seriousness aside, it's tryptophan, hydroxytryptophan, and it's a purer form than L-tryptophan, so it's broken down. Then it breaks down into serotonin, which is why it's super important not to take it with some scheduled SSRIs unless it's okay by your physician to do that.
Which is antidepressants?
SSRIs are selective serotonin receptor inhibitors. And then that component of serotonin, later on down the line, it breaks down into melatonin. So a lot of these patients who have a lack of serotonin, they have trouble with sleep too, because that's what we see is needed in there, is the melatonin hormone, which is, if it's lacking, you have difficulty in maintaining sleep. So what happens is 5-HTP helps initiate sleep. It helps to put on that decreased amount of activity when we talk about the resting state. And therefore, sometimes patients who lack that can really benefit from a little extra amount of that. And the herb that we get with hydroxytryptophan in the store, whether it be L or 5, does break down in the system in 4 to 6 hours. So it's pretty much out of the system pretty quickly. I usually tell patients for maintenance of sleep to start with a 5-HTP, and then you can add melatonin in that for sleep maintenance. And so the combination. Whether it be L or 5, does break down in the system in 4 to 6 hours. So it's pretty much out of the system pretty quickly. I usually tell patients for maintenance of sleep to start with a 5-HTP, and then you can add melatonin in that for sleep maintenance. And so the combination helps with initiation and sleep maintenance. But it is not, something that you want to utilize, again, without talking to the proper, physicians and making sure you follow up with that. Because if you have a level of serotonin, you don't want to do that because it will throw that off balance.
And another thing which can help them to calm down is the magnesium itself, what we already talked about. It has a very important function, not just in the muscle fibers, not just in your heart, when the heart relaxes, but it's also very important for your brain as well. So if you use it as an addition to the 5-HTP method or regimen, once you consult it with your doctor, it could be also help you to calm down before you go to the bed. That's when I prefer to take mine, and I use citrates, but there are several different kinds. What do you recommend?
So magnesium oxide, magnesium citrate have a good combination, but they do affect the bowels. So some patients do have looser bowel movements with that. Magnesium glycinate affects more in the muscles, and so therefore you tend to have a little bit more muscle relaxation with that, in addition to the a little bit of sleepiness that it helps with. So if you're looking for less issues with the bowels, then I usually suggest glycinate. And if you want to have looser bowel movements, you're having issues with constipation, oxide or magnesium, not glycinate, chloride, citrate, all those kind of help with bowel movements.
Right.
Yeah.
And the simple thing is what we always talk about and recommend, the omega-3 fatty acids, right? It can help with brain health as well.
Yeah.
Right?
So omega-3 fatty acids have all different, utilizations in the body, but it helps great with the brain to be able to solidify all the vessels in the body, but especially the vessels and the ability to get the circulation to the brain that you need. There's many studies out, that talk about the ability to maintain memory, and all these different products out there, that have combinations of all the different things we talked about. Another amino acid, when we talk about amino acids that they utilize, is L-theanine, which helps to keep and maintain memory, helps maintenance of sleep as well. So it helps to kind of calm people down, and that way helps with their focus and attention. It's used a lot of times in teas, in tinctures to kind of help. And so we find that that's useful as well. There's many things that can help the brain. I mean, this is really the tip of the iceberg, and really utilizing the ability to calm yourself down at the right times and utilize your focus and attention to energize or empower yourself during the day to be able to focus better is really how we can kind of use that seesaw patterning to help your brain the best.
Absolutely. And another thing is obviously, and that's why I always want to talk about exercise as well, because exercise can tremendously help you with focusing on to be able to deal with your stress. That's the most underutilized medication. Exactly. Exercise itself. And 15 minutes of regular walking can increase brain function. It can help you with the blood flow in your brain, because obviously it's going to create more blood flow in your entire muscle fiber.
We talk about how exercise increases serotonin levels. So when exercise increases serotonin levels, then we know that it's going to increase
exactly, circulation in the brain as well. So you guys have to pay attention for a little bit exercising, listen to Doc, and if you guys need any help, please reach out to her. She's always here for you guys.
Absolutely.
Exercise medicine, guys.
Nutrition is the key.